Before I go into the updated restrictions being announced today, I want to walk through a few slides on modeling and just take us through that. So we'll get started on that. So our current state. We can see that numbers over the past 4 weeks have been climbing consistently. We see that the predominant climb during much of that was in the Southern Health region, which we had previously been reporting on, but it's certainly not unique in the Southern Health region. We see cases climbing also significantly in the last week in the Winnipeg Health region. But this is showing the current trajectory that we've been seeing and what's made us, in some part, move to further announcements today. On the next slide, you can see that in addition to geography, if we look at the age, our case counts are increasing most rapidly in the 0 to 19, pardon me, 0 to 19 year olds. Which is consistent with other regions as well, but certainly a concern that we've been seeing, which leads us into some of the restrictions we are doing today. If we look at the modeling, when you model again about 6 weeks out from this, we see the on the next slide the current upward trajectory. Here we go. And again, just like with all modeling, the numbers provide us with a range of possibilities, but without any further restrictions, we see the upward trend in Manitoba. We see that this model here at about the 50% range would give us about 200 cases a day at the beginning of December, and climbing thereafter to mid-December. So again, increasing cases always translates to increasing hospitalization, increasing ICU, and that's where we get that strain on the healthcare system. So that is diagnosed cases in Manitoba and about six weeks out. If we look at the next slide, you can just compare the steepness of that trajectory. If we look at our Southern Health region, we see that climb is significantly steeper than.
All right, we're just going to pause for a moment here because it looks like the feed from Winnipeg has frozen. So we're going to try and reestablish that. And while we do, I'll tell you what you're looking at. Dr. Brent Roussin, who's the medical health officer, the chief medical health officer there, is speaking and updating us on COVID. And he's back. Again, let's listen.
Some of our most important things that we pay attention to are the strain on healthcare systems. We see ICU admissions here. And again, as we see numbers translating upward in diagnosed cases, that's going to translate into increasing ICU admissions. And we see here that this model at the mid-range of the predictions of this model would be predicting about 3 ICU admissions per day by early December and climbing thereafter. And what we've seen in previous waves, that's not a sustainable number. Admitting 3 individuals per day with COVID to the ICU on a sustained basis is not a sustainable number. And finally, just looking at ICU admissions and the ICU occupancy, we see at the top number there is non-ICU admissions to hospital, again climbing up. We see the ICU admissions on the lower graph, and again showing us that by early December, calling for 40 plus people in ICU with COVID. And so again, looking at the demands on our healthcare system, this would be something that would be a significant demand on the healthcare system, what's trying to currently keep up with all the non-COVID care and catch up on much non-COVID care. So these are some of the modeling numbers that we follow. We run those numbers essentially every week to follow the trends, and has led us in one way to the orders that we're going to announce today. So So in addition to this modeling, like we've always said, we take a number of things into consideration: test positivity, the actual trends in hospital admissions, certainly now vaccine rates we take in consideration. And so we've been seeing these concerning numbers. The projections are concerning, and so we know if we don't take further steps, we certainly are at risk of overwhelming that healthcare system again. So the additional restrictions that are being implemented today, or are being announced today, will be taking effect at midnight tomorrow. And so relates to the religious gatherings in Southern Health Region. So the religious gatherings are limited to 25 persons, unless the facility can physically divide their space into separate areas, in which case you can have several cohorts of 25 individuals. The total number of attendees at a service may not exceed 25% capacity of the facility to a maximum of 250 people. Again, that can only be achieved through the use of cohorts, if the overall capacity allows. So those cohorts must be separate. They must not mingle in any way. They must have masks on at all times, and distancing rules apply. So this one, again, applies only in Southern Health Santé-Sud region. The previously announced municipalities that are in that capital region, again, are not going to be treated as part of the Southern Health region as for these orders. So Cartier, Headingley, McDonald, Richat, Niverville, St. Francis, Xavier, and Taché will be treated as the capital region as per the most recent orders. So this goes into effect Saturday, November 13th, 12:01 a.m. And so again, services that are restricted to fully immunized individuals, and including those under 12 who are not eligible for vaccine, they can still be held without capacity limits in Southern Health. Services that will not require proof of vaccine will have to abide by these new capacity restrictions starting tomorrow midnight. The next restriction that we are moving to is a province-wide restriction, and it relates to that climbing case counts in that 0 to 19 age group. And so proof of at least one dose of vaccination or a recent negative test will be required for the 12 to 17-year-olds for indoor recreational sports. So this one, we will have a grace period to allow sufficient time for people to make decisions. And so this will start on December 5th. And this will allow individuals who are not fully immunized or not immunized to comply. This will be in effect province-wide. Negative tests need to come from participating pharmacies. This will not be tests done at our publicly run testing sites. Those PCR tests are for symptomatic individuals or those individuals directed by their healthcare provider to be tested. This testing will have to be done privately for the sports. And we'll be working with our partners across the province to ensure a planned transition to this new restriction. So these orders will continue to allow fully vaccinated Manitobans to enjoy as much freedom and as few restrictions as possible, while unvaccinated individuals will continue to be restricted in their activities in order to reduce transmission and really and that risk. Again, these are fellow Manitobans that are falling ill, being admitted to ICU. Unfortunately, some still dying. And the more that we can get vaccinated, the more that the unvaccinated are limited in the interaction amongst others, the more Manitobans we're going to protect from COVID. So I want to thank all those Manitobans who are following the public health orders and the fundamentals, and of course the vast majority of Manitobans who have been vaccinated. So I know it's frustrating to be here again. I think we're all disappointed, we're all frustrated that we're once again looking at further restrictions, once again looking at upwards trajectory where our healthcare system is again strained, which really puts that strain on COVID and non-COVID care. All right, so we need to continue to do what we can to bring down transmission to protect all Manitobans, whether they have COVID or not. The updated orders keep the pandemic response system at restricted orange, with schools still remaining in the yellow, and all the other public health orders remain unchanged. So again, I can't stress strongly enough the need for our public health orders and the fundamentals to be followed. The orders have always been only one piece of our response. It always, our response, the success to our response always relied on Manitobans. We always have relied on Manitobans to do what's best for Manitoba, for themselves, and to protect themselves, the people around them, and our province and our healthcare system. So please follow those fundamentals. Please adhere to these public health orders, and we need to continue to follow things. And if we continue to see strain on our healthcare system, further steps may be required.